This is Andy Schumann for MidGizmos with another interview. Today I'm discussing the Mightier Program with Emily Stone, who is a social worker who is the senior clinical strategist at the Mightier Program. And welcome, Emily.
Thank you. It's so nice to meet you, kind of, over the phone. However, we're meeting people nowadays. It can be tricky.
So I hope you've remained safe during the COVID pandemic.
I hope you as well. Yeah, keeping family and friends safe.
I think we're all good. I'm back at work seeing patients and trying to stay safe and protected. And the pandemic has created new opportunities for companies like Mightier. So I wanted you to tell us a little bit about what the Mightier Program is, for starters, and then we'll take it from there, because I want to find a little bit more about its history, as well as the studies showing that it can be a very helpful program for kids with ADHD and anger issues and anxiety and so forth. So without further ado, can you tell us what the Mightier Program is?
Yeah, absolutely. So I'm excited to be here and I'm excited to talk about it. I think you are correct that definitely we are not expecting this to be, something that would be useful in the pandemic, but I think it's become a useful tool for a lot of families. So yes, we are Mightier. We are based out of Boston. Our original clinical trials were out of Boston Children's and Harvard Medical School. We essentially are a biofeedback video game company that specializes in helping kids to build emotional regulation skills. That's my fancy way of saying we have kids play games and they better learn coping skills to use in everyday life. So for anybody that's not familiar with biofeedback, typically it's done, in a clinic setting. We have kids or adults, wired up to some machinery that's registering their heart rate or, their neural waves or, their pulse or something like that. But what we really want to do is help kids to be able to use that in their home, right? So we know kids are comfortable in their homes. We know they're surrounded by people that they love and that care for them. And so what we found is that we're able to bring this into a fun at-home space for kids to really engage through something that really speaks to them, which is video games. And so I can show you a tiny bit. I'm not going to play on the computer because I've done that in the past, but I will show videos for sure and kind of walk you through it. But for anybody that's seen it,
I can certainly show some of the videos and so forth.
Yeah, definitely. Or I can even share my screen maybe too. That might be helpful. I've done that in the past. I mean, I can attempt to play, but if I tell you anything.
Why don't you just describe what it is for starters?
Yeah, definitely. So kids are going to be given this tablet, fun and funky with its fun case, and they're going to be wearing a heart rate monitor. The heart rate monitor is worn up on their arm. And what we're doing is having kids for the first time see a visual for their emotions. So kids are playing, they are wearing the heart rate monitor and we're sensing where their heart rate is. They're playing a variety of different games. We have about 26 right now. And kids are challenged throughout the games. When their heart rate goes up, the game gets more difficult, which seems counterintuitive. But when the game gets more difficult, they actually are encouraged because they want to continue playing to bring their heart rate back down. So we give them the option, right? We say, you can do this by yourself, or some of our characters in the games help to prompt them through some skills, and they'll bring their heart rate back down. So really what this is based off of is building this muscle memory for emotional regulation. So kids are able to bring their heart rate up and bring it down about 1 to 2 times a minute while they're playing. And that will help to build that emotional muscle or, really get them emotionally fit so that they're able to do that better off later down the line. When they're presented with a problem in real life that they actually need to bring their heart rate down.
Okay. What ages is it directed at?
Yeah, absolutely. So we typically say 6 to 14 for independent play. What ends up happening is that if a 6-year-old or a 7-year-old with a younger sibling gets it, younger sibling wants to play. So they can absolutely play. There is some reading that's involved. That's why we say 6 to 14 for independent play. What often happens after 14 too is, the games are definitely fun. Plenty of adults play, but the games get a little more, younger for our 14-year-olds than some of the ones that they'd be interested in typically.
So there are games that are directed at different age groups.
Yeah, so it's a variety of ages for sure. That 6 to 14 is really where we just see prime engagement for kiddos. But honestly, we have adults playing very regularly and parents who are like, this has been helping me out a lot. So anybody can find a game that they like.
And how many sessions per day, per week, per month do you recommend?
Yeah, it's a super good question. So what we say for families to shoot for is 45 minutes a week. And we say however you can fit it in for your family, right? So a lot of families will ask me like, okay, should it be every day for 10 minutes? Should it be, all in one chunk? Whatever really fits works best. I think what we say often is, okay, like if kiddos sitting at soccer practice and need something to do 3 times a week, their sibling soccer practice, then play then. If it's mom's making dinner and they need to do something after homework, play then. So as long as it's 45 minutes at least, is what we find helpful. Yep.
Okay. And I noticed online that it's $50 per month, right? With a discount if you prepay?
Yeah, so it depends on what subscription you actually get. So for the monthly membership, we have a monthly, a 6-month, and a 12-month option. So
Okay.
if people are going to pay monthly, it's going to be $40 a month. If they do 6 months, they pay $204, I think, to begin, and then it's $34 a month after that. And then for families that are going to play 12, they're buying 12 months up front, it'll be $336, and then they'll be paying $28 a month. So they'll be paying that kind of lump sum at the beginning, and it will be, prorated down from that per month.
And this is biofeedback. Is that correct?
Yes.
Is that the right way? Okay. And the obvious question is, I forget when the American Academy of Pediatrics updated their recommendations. I believe it was within the last 2 years. I'd have to research that. But they did not recommend, if I remember correctly, biofeedback as a modality for ADHD. So it's kind of, kind of offline, if you will. Is that still the case?
Yeah, so I can tell you a little bit about our trials in particular. So
Okay.
so we had 4 original clinical trials. We're still doing a lot of research out in the field as well. But our 4 that kind of helped stem Mightier out of the halls of Boston Children's Hospital and Harvard Medical School. So it was 4 trials, 2 double-blind randomized control trials, where kids were playing for 12 weeks, right? And there was a control group against normal therapy modalities. We weren't highlighting specific diagnoses. We were highlighting certain behaviors. In these 4 studies, we were highlighting, child outbursts, oppositional behavior, and parental stress. And so what we saw after the 12 weeks was kids had a reduction, 62% reduction in child outbursts, 40% reduction in oppositional behavior, as well as like a 19% reduction in parental stress. What we found since then, right, is that, and we've been out in the wild, is that a lot of families are using us for their kiddos who have an ADHD diagnosis. Again, we haven't specifically studied the ADHD realm, but the ADHD symptoms that come with impulsivity or frustration tolerance, or really being able to make that kind of mind-body connection is where we see families really seeing the benefit of Mightier, and integrating that kind of into one of the tools in their toolbox for their child's diagnoses.
Okay. So where did it originate, and when? Was it out of Boston Children's or Department of Psychology, Psychiatry?
Yeah.
Was there a grant associated with this?
Yeah. So we were in Boston Children's. Our chief scientific officer, Jason Kahn, worked there. He was doing research as a developmental psychologist at Boston Children's. And so, he went through many iterations of what Mightier has become today. I mean, there was, different versions where biofeedback was tied into kids racing cars. There was different iterations of, classic board games like Jenga and kids' heart rate increasing and the, table wobbling. So it was harder for, kiddos to play. And really where it ended up at the end of, these 7 years of research and development was kind of where we're seeing Mightier today. I think I can speak for myself. I've been here for 3.5 years now. And so where Mightier is 3 years ago and where it is today is, a very, very different world. We have a lot more, player engagement and different strategies to do that. The characters are a lot more developed, the narrative within the video games themselves. But yes, those initial trials were out of the halls of Boston Children's. And really in a way that we saw such awesome results kind of there, that we wanted to make sure this was out in the public and into the hands of, you know, as many kids and families as we can get it to.
So, I'm sorry?
You have a question?
Yeah, you can, Mitch, go ahead.
Can you explain a little more how the heart rate is integrated? I know you said the watch is on, but where does the feedback come in and who's looking at the watchers?
Absolutely. Can I share my screen, Andy? Would you
Right
mind?
ahead. I think you can, because
I think I can too. I'm going to try, because I think, to be honest with you, for me, I'm all about the visuals. And I think this kind of can be helpful for everybody to see.
Yeah.
So can you see this?
Yes.
I can.
Great. Okay. So I'm going to show you what a basic game looks like and the visual around the heart rate. So like I said, child will be wearing a heart rate monitor on their arm. It's Bluetooth connected. And this is what they'll see on their designated Mightier tablet. So this is one of our games. Again, we have about 26 games. This is called Hibachi Hero. The goal is for them to be cutting this fruit and these meats and not cutting the trash, right? In order to get, you know, as much as they can and in order to earn.
Practical.
Especially at lunchtime.
Yes, we're learning practical skills as well. So what you're gonna see here, and I'm gonna restart this for 1 second. Down here, I'm gonna pause it, is what we call the gizmo. So the gizmo is the visual way that we're representing a child's heart rate. The blue is, okay, their heart rate is low, they're calm. The gray is their heart rate has increased to a certain threshold. If this is personalized for every child, that we're starting to sense that there's an increase. And then this red, which is our heart rate has risen to a point in which we're starting to notice we are frustrated, anxious, overly excited, a bigger feeling. And what we're gonna see here is that this child's playing, and once their heart rate gets into that red threshold, the game is gonna become more difficult. So what you're gonna see here is the red flashing, you know, border and this steam come over it, right? So you're gonna see right here. So here, I'll back it up for a second. This child's in the red. It's very hard to play, right? If this was you playing and when you get yours, you're gonna see, okay, it's really hard for me to see the fruit. It's really hard for me to see the vegetables. And you're gonna wanna bring your heart rate back down. Kids have the choice while they're playing Mightier. They can choose to pause. So we have a pause function that will keep the game exactly where it is, or they can try to play through it. The reason we do this is kids need autonomy and choice. Oftentimes when we're doing more traditional therapy with kids, they don't have this autonomy or this choice. And so we want to give kids the chance to decide, right? If they continue to play, it will be harder. If they choose to pause, it won't be as difficult. And so what we're doing here is kids are increasing their heart rate all the way into that red and all the way back down to that blue so many times and so often that they're able to kind of build up that muscle memory and that essentially that biofeedback piece that we would normally be having kids.
The game automatically raises it to a more challenging level if your heart rate stays low for a certain amount of time?
So if it stays low a certain amount of time, is that what you just said?
Yes.
Yeah, so yes, we do, as kids progress, we do intentionally get them a little more frustrated. So naturally the games will get more difficult, right? So they'll get to higher levels of the games that will make it more difficult for them to play, therefore increasing their heart rate and kind of that engagement a tiny bit. But also if we're seeing kids stuck in that blue, right? So if kids are expert video gamers or they're not feeling, you know, incredibly frustrated or overexcited or anxious, what ends up happening is we adjust their threshold so that they're able to get into the red more often and still get that practice. What we often hear from kids, and I often say this when we're presenting this, is that we don't want kids being like pinned up into that red, right? We don't want kids having outbursts while they're playing. And what we'll often hear from kids while they're actually playing is, I didn't notice I was in the red. I don't notice that I'm frustrated yet, because we're really helping kids to pinpoint the first signs of when they're getting upset or when they're getting frustrated or when their heart rate is rising. It's a pretty low threshold to prevent, you know, big outbursts, kids getting really upset and things like that happening. Yeah. And so yeah, I can show you.
Go back. Go back to the, stop sharing your screen so we can ask you a bunch of other questions.
Yeah.
So that's very helpful. Now, I think traditionally biofeedback, and correct me if I'm wrong, is done with somebody hooked up to a brainwave and EEG.
Yep.
And you, I guess the idea is to learn calming strategies and so forth. So you've taken that to the heart rate, which, you know, does increase with anxiety and frustration. How do the kids learn calming strategies?
Yes. Yeah. So a couple of things. We brought it to heart rate for a few reasons. One, heart rate is definitely the most accessible thing to do in your home, right? So we want this to be as widely accessible and easy to use for kids. When you typically look at those classic pictures of biofeedback. It's people laying, really
Yeah.
still. Everything's all connected. They have the whole cap on for the EEG, and we know our kids. Any kid who has, any amount of energy is not going to sit there. So we want it to be really, really flexible. So honestly, this is one of our heart rate monitors. It's used at gyms, it's used for Peloton, it's used for all these things that, it's really, really flexible and easy.
Right.
It's not connected. That's the reason that we went for that. And also it's very malleable. I think like for heart rate, yes, what you said, it can be, I'm excited, I can be anxious, I can be upset, I can be frustrated. So really harnessing all of that piece in. And so for the skills, so what we tend to see is after 45 minutes, around 4 to 6 weeks of play is where we start to see kids translating these skills outside of the game. What we do teach kids, so I can show you another video of what this looks like as well, but when kids choose to pause, so I just showed a video of, they're playing through the red, they're bringing their heart rate down. If they choose to pause in the moment, we are walking them through 4 different skills. And so
that's great. So that would be great to show.
Let's show you. So, and again, we are all about kids being, pilots to their own kind of journey with this. So for a lot of kids, what we will see is I'm just trying to share my screen, is that they'll use skills other than the ones that we teach. But these are 4 that we teach in the game. So what I'm going to show you now is a different game. So this is called You Must Build a Boat. It's definitely one of our favorites. They're going to be matching 3 in a row in order to get further in here.
It does look like fun. This is a game I would play.
There you go. And so you're going to see when the child got into the red, they pressed on the gizmo, and this character called Dr. Dragon is going to walk them through 4 different skills, and they get to choose. So this child picked deep breathing. It, walked them through what it would look like to deep breathe, and they collect a character. So if kids choose to pause, they collect a lavaling, which is what the character is called. This one is called crossing the midline. It's a super OT based intervention. Where they're crossing their center, helping to connect the left and right brain. So that's another skill that they teach. Progressive muscle relaxation, which we all know, squeezing our muscles really tight and releasing them in order to feel a sense of relief. A lot of kids tell us this is their favorite one. But so Dr. Dragon walks you through these skills. Our goal, right, is to say, okay, kids are sensing that their heart rate has risen and decreased so often that they're able to do this, and their body's more automatically able to do this. They're developing this muscle memory. But especially in the beginning, kids are really using these skills initially to connect and better understand what their options are. This is a mindfulness activity where we're being super mindful and tracing one line, thinking about one thing. Often kids tie this with deep breathing. But what I like to highlight here is that we give kids choice, right? Like I think so I'm a social worker. I work with kids for a very, very long time in an individual setting. And a lot of kids would tell me like, I listen to my favorite song. I can, engage in positive self-talk. I can think of my favorite place, and I'm able to bring my heart rate down, right? So we're helping kids to not only see samples of what could be helpful, but also kind of explore and discover what will feel good in their bodies and in that moment.
Okay. Is there a educational component for parents? Because internal to that game, there are strategies. Is there an explanation where the parent can help the child perform those actions?
Yeah, absolutely. So our parents are wonderful. I do want to say that they are all very, very excited to be kind of integrating this and understanding this. But even as we're talking, right, and what I find for a lot of parents, there's a lot to learn here. And so we kind of take parents on a journey through, we have online resources, we have the dashboard, we have weekly emails with activities and things to highlight for the parents in different ways that they can kind of model, use these skills, use this language, and kind of integrate this on that journey with them. And so we have support along the way. We have a family care team that, if a child's struggling with engagement or a parent has direct questions, they are, a team of master's level clinicians, and they're helping out. So
yeah, go ahead.
This has been going on long enough that from the analysis of the data, in terms of the children that it's been most successful for or least successful, are there any specific variables or commonalities that are more likely to be associated with success or failure or incorporation into the areas of their life that you are hoping for that are internal to the actual game itself?
Question. Good question.
Yeah, it's a very good question. Yeah, so I think in terms of our clinical trials, we saw it really, really helpful for opposition, kind of those aggressive behaviors. And so those specific symptoms can be really, really helpful. What I have seen just throughout the last 3 years of just working with families kind of in the wild is, kiddos who are struggling with impulsivity, kiddos who are struggling with anxiety, who are, not really understanding or feeling very fearful of the body that they're in, right? So what Mightier does is really ground a lot of kids to understand that connection between their brain and their body. And so, any impulsivity, any anxiety. Right now we're running a pilot program with a lot of clinics who have kids with autism spectrum disorder. So really helping them with that, rigidity, and helping them to better understand when to use those coping skills. I think ultimately for me, what I always say is if you have a kiddo who can name every single coping skill in the toolbox, right? They can say, I know I'm supposed to take deep breath. I know I'm supposed to walk away from the situation, but I just can't, right? That's where we often see kids stuck. This can be a really, really helpful tool to help them kind of bridge that gap so that they're able to really utilize those skills in the real world, and they're actually getting that practice in the moment to do that.
Daisy, what has your experience been? Many of the children that we see that are angry are in homes where the mom and dad have not living together for one reason or another.
Yeah.
Certainly in many of the kids that we see in terms of evaluating and treating for issues, whether it's anxiety or anger management, the approaches of the two parents, especially if they're in two different homes, is completely different, whether it's on medication for ADHD or other issues. So what's been your experience in children that have these issues that are living in two different places at various times and have different approaches from the different parents?
Yeah, I think that is a great question. And I know that world well myself as a social worker.
Yeah.
I think from the experience of just having kids play this, right? So like I said, our parents are wonderful. Our parents who are playing along with their kid and understanding this are wonderful. The great thing about Mightier though is that a lot of this is independent play for kids. A lot of the kids who play do not even know why they're playing Mightier. They don't know that it's something that's helping them to build emotional regulation skills.
Don't know that it's medicine.
Yeah, they don't, because it's fun, right? And so what's pretty cool about that is that we're giving kids a lot of independence to actually use these skills. Is it great if parents are playing along? Is it great if they're using this language? Is it great if they're modeling? Absolutely, right? But what we know is that kids, if they play this 45 minutes, are getting that practice no matter what. What we see is that, if kids are playing, if they're raising their heart rate and lowering it back down and practicing those skills enough, and are really, if parents can agree that they're playing 45 minutes a week, awesome, they're getting the practice that they need. It's not necessarily like parents need to have a shared language or communication around this. Kiddos are really playing in order to practice, and that practice then translates, if that makes sense.
Yes.
So really it's a more independent piece for the kiddo.
Okay. What are the indications? What can this be used for specifically? So I have kids with, a variety of problems. So tell me the indications and the benefit for those various indications with kids.
Yeah, absolutely. So I think, like I said, I think we know for kiddos who are struggling with any emotional regulation concerns, this is helpful, right? So I hate to structure it to specific diagnoses, because I think if this pandemic has taught us anything, it's that everybody needs practice with emotional regulation at some point.
But I think pediatricians need guidance when to recommend a Mightier program. So, when we do a diagnosis and they fill out Vanderbilt forms, we come up with, oppositional defiant disorder, ADHD, anxiety, all those things are appropriate for the Mightier
100%.
program?
Yeah, yep, ADHD, anxiety, autism, oppositional defiant disorder. I think even kiddos who are kind of on the fence around, is this a disorder, is this not a disorder? I think it can be a really helpful introduction into, social emotional learning and those coping skills. And also, folks who have been in therapy for a really long time, right? Like if we're kind of feeling stuck in therapy or medication at the moment, we're not seeing a ton of progress, opening up kind of this door for families in a different way to learn can really be helpful as well.
Right. Okay. And roughly, this started, was it 3 years ago or 7 years ago?
So our research was 7 years ago. We started selling directly to consumers in 2016, I believe. So Yeah, yep. So,
Is it still affiliated with Boston Children's? Is it a totally independent program at this point?
so it's an independent program. Our chief scientific officer is still on the faculty at Boston Children's.
Okay.
And obviously we still have very close relationships with them. But yes, we're
And
separate.
I've seen you've had a lot of poster presentations. Any clinical studies that have been published in peer review publications?
Yeah, so I can actually send you a bunch of those. We're constantly just trying to continue to validate this and say, okay, these are different ways that you can use it. And so I can absolutely send you our current studies and a few that we've recently gotten approved so that you can
How
share
many
those.
kids in the, since 2016, have you had hundreds, thousands of kids enrolled in the program?
Thousands. So right now we're at about 15,000 active families, but honestly, since kind of our inception, I think it's been around in the 20,000s. We have a lot of folks out there. Yeah.
So that's significant. Now,
Yeah.
just to clarify for our viewers, which are primary care providers, can you highlight the difference between biofeedback, which is what your program does? How does that differ from behavioral therapy? How does that differ from cognitive behavioral therapy? Because my understanding is in cognitive behavioral therapy, you're still teaching coping skills.
Yeah, absolutely. Yes. And so this is actually one of my favorite things to talk about, just as somebody who is very much trained in the CBT mindset. And so I think kind of the difference between these two. So if we're to walk through what a traditional, CBT approach would be, would say, okay, we're going to teach kids to recognize what they're feeling in their body, right? We're going to say, you're going to recognize when you get angry, your palms get sweaty, your fists get clenched, your eyes get, squinty, or when you feel anxious, you feel butterflies in your stomach. So you're first recognizing, then we're teaching kids to label, right? So we're saying you're going to label what you're feeling and you're going to use all these wonderful feelings vocabulary words that we give kids, right? So we say, I feel upset, I feel frustrated. And then, we're going to walk them through tools that they can learn, right? To actually implement those. So we're going to say, when you feel frustrated, you can take a deep breath. When you feel, anxious, you can let somebody know, or you can use some positive self-talk. Then we're going to encourage kids to use them. And if that fails, use another tool in your toolbox. So it's really around recognizing, labeling, and then building up this toolbox. And what we're doing with Mightier is, instead of going through that whole process, which is super, super cognitive, as it says in the name, right? A child has to think all that through. We're saying, okay, forget about it. You've practiced bringing down your heart rate so often when your heart rate is increased that your body's automatic response now is to use a tool, right? So they don't have to go through recognizing or labeling. Their body is sensing that there's a heart rate increase, and the automatic response, because they've done it 1-2 times a minute for 45 minutes a week, is that it's easier to do. And so often the example I give is, right, I was a school counselor for 4 years. I had kids in my office who we'd meet before recess, and they'd be like, I know this is going to frustrate me. I know what this kid's going to say X, Y, Z on the playground. I'm going to walk away, Miss Emily, right? And then they'd come into my office half an hour later after recess, sobbing because they got in a fight, because they couldn't actually use the skill, right? Even though we talked about it, because they were practicing it in a space that's calming, that's comforting, right? Where we are able to think it through. And when they're in the moment, they can't do it because they haven't practiced.
Have your studies shown that Mightier is as effective as cognitive behavioral therapy? Is it more so for some things?
So for our original clinical trials, where I was talking about the 62% reduction, the 40% reduction in child outbursts and oppositional behavior, that was compared to CBT. So that was, the control group was getting CBT. And so they saw, a really, really significant, change comparatively to that, especially for kids who are struggling with those outbursts or that oppositional behavior. So obviously we are still a work in progress. We are still, trying to figure that out day to day.
So
but
just to clarify, in those studies, did CBT achieve a 50% or a 30%, where you achieve 40%, or some relative comparison you can provide us?
Yeah, that is a super, super good question. I'm going to have to, I wasn't on the initial team that was doing that. So I'm going to get back to you and send you kind of that scientific overview for that, if that's okay.
Yeah.
I want to make sure
I think it'd be nice to, again, clarify for our listeners, our viewers. The other question is that I imagine this cannot be paid for by insurances because it's not approved by the Academy of Pediatrics. And have you made any efforts to get it approved by the American Academy of Pediatrics?
Yes. Well, so not the American Academy of Pediatrics. We are directly partnering with an insurance company right now. You can actually look this up and I can send you some press releases as well. So we're teaming up with Magellan Healthcare, which is an insurance company out west, and they are piloting Mightier in a few of their clinics to see if it would be able to be, you know, purchased and given to families through the insurance route. Definitely, this is something that we are very aware of, that this is not something that a lot of families can afford. And so helping, you know, us to better understand that and kind of help families to
because counseling is so hard to get in the pandemic and outside of the pandemic. And I find most kids can't really get into counseling because it's a big commitment of time.
Yeah, a big commitment. And I mean, I think pandemic wise, I mean, telehealth's really hard with kids, right? Like you're speaking to somebody who is attempting to do it often. I mean, it's hard. So meeting kids where they're at in a video game platform is something that we definitely, you know, are very excited about and trying to get into more hands of kids and families. So.
Now, the other interesting thing is that last recommendation from the Academy of Pediatrics, well, they probably mentioned cognitive behavioral therapy. They transitioned from cognitive behavioral therapy to behavioral therapy. And I've been using Me Health for ADHD for some time. And the way behavioral therapy has been explained to me, it's kind of like bribing kids to try and focus. So you're saying, if you pay attention, okay, I will reward you with more video game time or something that you want. We'll get you that Mercedes you've always wanted. Yep. So how does that work? I mean, you're motivating them. You're bypassing recognition, labeling. You're going right to greed, right? How does that work? I mean, because it seems to, because they say there are studies supporting that, you know, reward systems work.
Yeah, absolutely. So I think a couple of things. We have a couple of different rewards here, right? Like one, like I said, a lot of kids don't know why they're playing. And if they do know why they're playing, they're excited to play because it's not sitting down talking to somebody. That reward piece is interesting. So within the games themselves, kids are advancing, right? Naturally, when we play a game.
Behavioral therapy.
Yeah, we're getting a reward. Also, when we are having kids pause and kind of preview that skill, so that second video I had, they're collecting a character, which is also a reward, right? But that within the games themselves, they're collecting, you know, coins, they're collecting points to upgrade. So there is all this, you know, reward system within the games themselves. If there's not, you know, a reward set by the parent or by whoever's playing with the kiddo to actually play. But what we often find is that kids don't need the reward to play, right? Because they want to. They're intrinsically motivated to play, and learning is built into that play.
Okay. And you said something about there are some tokens that they can accumulate if they learn certain skills.
Yeah, so they collect these characters called levelings. This is actually one of my favorite parts of Mightier. So they collect these little rocks. So essentially, there's a huge narrative in the game around, you know, there's this dragon and her job is to collect these rocks that are hot lava rocks and to cool them down. And so there's this whole narrative, right, that the character takes the...
So there's a little story.
Yeah, but all the levelings, you know, have their own story, right? And so what we find is that kids often relate to these levelings. So the one I always say I relate to is Diego, and his voice is too loud. I have a very loud voice. And so a lot of kids relate to kind of the goals or the struggles that these characters have and are able to really have kind of conversations around that. So creates a cool narrative approach.
Interesting.
Yeah.
And do you have brochures that pediatricians can distribute?
Yeah, I'm happy to send along some overviews. So we have just some basic product overviews, some scientific overviews. I'm happy to just send all that to you so that you have it for anybody who needs it. But yeah, anybody who's looking for more information, I mean, it's easiest to probably just go to our website.
Okay. And as a prescriber, I mean, everybody has their own tool set. My tool set is prescribing meds for kids with ADHD, kids with anxiety. You know, I've got a tool set for that. I'm not so good with oppositional defiant disorder. That's your tool set. But can you use your system to kind of monitor the efficacy of medications? I'm just curious about that.
Yeah, that's a really, really good question. I don't know if monitoring the efficacy, but I think it can be helpful to just use in conjunction, right? I think I always say like Mightier, just like meds, just like therapy is another tool in the toolbox, right? This is not the solution to everything, but I
they would get better scores. And is
yeah, that's an interesting
mechanism through Mightier back to the provider regarding baseline versus you know, how a kid is doing 3 months out, or people getting feedback, parents as well as providers.
Yeah, I can't say that we've seen direct feedback along with medication, right? But I can say that, yes, over those 3 months, we're seeing changes, you know, in the amount of time that they take to cool down, right? So we're measuring for families, you know, when a kiddo starts playing, how long does it take them to bring their heart rate back down once they're triggered to? So a lot of times we'll see a decrease for kids over time. And so I think, you know, in conjunction with any treatment, you can absolutely look at that.
All the information gets back to you through computer programs? I mean, the people analyze the data?
Yeah, so the parent has access to a dashboard, which allows them to see the amount of time that they've played, amount of, you know, seconds it takes for them to cool down is what we call it, amount of times that they've done that. So giving parents kind of a deeper look into that as well. And so, yes, I mean, I think our best stories and where we see the most progress is kind of like those more qualitative stories of just signs of progress, but absolutely parents see, you know, progress with how long it takes their child to cool down and things like that. That could be used in conjunction with medication.
Yeah, it's very interesting in that I first learned about this program, and I learned about it recently, although you've been around for years. And there's not too many things I'm not aware of, but it's interesting because a parent told me they're using your program, or they were very pleased with it, and it's a difficult child that just started on medication. So very interesting.
Yeah, that's great. I'm glad that they were able to share that with you. And
that's great.
Yeah,
okay, so thank you, Emily Stone, for sharing your wisdom and enlightening our audience regarding the Mightier program.
Absolutely, and I'll send all that information along to you.
Yeah, and thank you, Mitch Frumpkin, who's been popping in and out of my contemporary.
Like a ghost. Appears like a ghost.
I did like that. It was entertaining.
I have to decide how to edit this video.
Yeah.
So, it was entertaining to watch.
Kind of like an aura. Yeah.
That's right.
Yeah.